Welcome back. A recent study by Cook County Health revealed that in Cook County, 1 of 5 women suffers from postpartum depression. The Silent Cries project focused on 2 health centers in Logan Square and the south side of Chicago. To talk to us more about the results of the study and what can be done to help these new moms, we have Dr. Whitney Lynn, family medicine physician at Cook County Health. Good morning. I was telling you that for me, this is such an important topic because specifically in our culture, in the Latino culture, we don't talk about being sad and depressed after having a baby. We're supposed to be thrilled, enamored, and ready to become the best mother ever. So how much does that cultural barrier have to do with this postpartum going undiagnosed? So
when we did our research study, it showed that, you know, a lot of our women, especially in our Hispanic communities, were coming to positive for the PHQ-9, and then a lot of them were not receptive to getting the help.
Got it.
And I think a lot of it has to do with the cultural barrier of not accepting, of saying, oh, there's something going on, versus saying, oh, is it also in a political climate that we're also in, like afraid to get that kind of assistance.
Because of their documentation or lack thereof.
Right. And what our goal is to really let them know that we're there for them, because it doesn't just affect them, but it affects the family. So, you know, doing all this research, we realized that children who are with mothers who have postpartum depression, they're 4 times more likely to have behavioral problems. And then there's future depression. So then they're 7 times more likely to have depression by the age of 18. So it's not just about the mother getting help, because it affects the family and it affects the growing child.
And that goes for anything. If mom is not doing well, the rest of the family's not doing well. And that is so hard sometimes culturally to understand it.
Very much.
Because you put the kids first. And we're talking that postpartum depression doesn't have to be like you and I were talking about the moment the baby's born, the first 6 weeks. It can just pop, it could just creep up in the middle of, like, at the 10th month of you have had a baby.
Right. And actually doing this study, we actually found that more women were depressed after 4 months. So a lot of times those women fall off because they go to their 6-week checkup and then they don't go back to the doctor. And so our goal was to let's screen them every time they bring their child in, because then we can keep an eye on them and make sure that they aren't having those signs and symptoms. And sometimes the mom doesn't even notice it. You know, the mom's being a mom, the mom's being a wife, the mom's being an employee. So there's so many different roles that they're playing that we want to help them in real time.
What did you learn from the study that you can implement change at the Cook County level?
So our goal is once we recognize it, how can we help them? So when we recognize it in our clinic, so we've actually trained our staff. When we have it and we see a positive score, what we do is then we give it to our behavioral health social worker, and they're able to talk in real time, like, how can we help you? Should we bring you in more often? And it gives them a connection, and it's not just about the baby. And a lot of our women who have done it, you see their numbers go down every time they come back in.
Is this an exam that is given before you have the baby, or just only for postpartum?
So no, it's also given at the beginning. It's given throughout prenatal care. It's actually given while you're in the hospital and you have your baby, and then it's given at your 6-week check. But usually that's when it stops, at that 6-week check, and you say goodbye to your OB or you say goodbye to your family medicine physician. You don't have that connection anymore.
That's true, you don't go back.
You don't go back. So, but the baby always has to come back. The baby needs to well child, the baby needs to get weighed, the baby needs their vaccines, and usually it's the mother who brings them in. So there's our opportunity to make sure mom is okay.
So are you training pediatricians to do this too?
Right, so it's pediatricians, family medicine, who really get to do it. I'm very fortunate because I also deliver babies, so I get to be there for the whole spectrum of life. But we want everyone to actually be trained to know how to do this.
When did the screening start? Because I had my first daughter at 12 years ago, and I don't remember ever being asked before, after, during, at the hospital how I was feeling. I was given a piece of paper that said, if you haven't gone to the bathroom, if you're feeling sad, then you can call us. But I wasn't reading that. I just heard what the information they gave me about the baby. When did they start screening? Because when I had my 6-year-old, he's 6 now, that's when the questions started.
Right. So, you know, we're supposed to be asking, and so we don't give that piece of paper anymore. It's now face-to-face.
Good.
So it's our nurse, it's our medical assistant who's actually looking you in the face and saying, are you feeling like this? Is this going on? And so it's now you don't have to even worry about that health literacy barrier, because that's also an issue as well. So now we're able to have that conversation, and when anything that screens positive, they inform us as the physician, like, you know, Dr. Lynn, this is going on. I think we need to pull them aside. And then I get to talk to them and say, okay, what's going on? And then I give them to someone else, like, we need to find out how we can better help them.
What would you like to tell women who are now pregnant or have had the baby and are not feeling great, but have this thing of, it's just, I'm tired, it's motherhood. What would you like to tell them?
So women always feel like it's because they're tired.
Yeah.
And, oh, it's the hormones. And it's not. And it's okay to say, I need a little help. It's okay to say, I need a little assistance to get over this barrier, because it is hard being a mother.
It is.
It is the hardest job I have ever had.
Amen. Dr. Lynn, thank you so much. Such valuable
Yes.
information. All right.